Hi, it's a real honor to be here facilitating this panel today. This topic of supporting the front line is one that's very important to us at FedEx. We have 500,000 team members around the world who are on the front lines, delivering medical supplies and household items. And we're starting to deliver holiday gifts on top of all of that. And then very soon, vaccines. So it's very important to us that we look at how we can support these team members. And as I was looking across the names of the other companies at this conference and those on this panel today, I was just really struck by how many companies and industries have employees who are really truly keeping the world moving during this time in ways that many of us probably haven't even realized if we haven't stopped to think about it. And so supporting them is really just one of the most important things that we can be doing right now. So to talk more about that with me today, I'm joined by this very esteemed panel. First, Melissa Broats. She is president of Abbott Fund and the chief marketing and communications officer for Abbott. Nancy Lamb is president of Dow Company Foundation and the director of global citizenship for Dow. And then Hugh Welsh, the General Counsel, Secretary, and President of DSM North America. Melissa, Nancy, Hugh, thank you for joining me here today. And I know we've got a lot of ground to cover, so I'm just going to jump right in with our first question, which is, since this pandemic and the lockdowns began, this term of frontline workers or essential workers, it's really developed to encompass this large number of people who must still report to work despite the pandemic and the concerns around the world about their health. So who are these frontline workers for each of your companies that you are supporting? And tell us a little bit about how you're doing that. And Nancy, we'll start with you.
Okay, great. Thanks, Jenny. I'm really glad to be here. And thanks to all our frontline workers. You have made such a tremendous difference, and we are grateful. So I am very proud to say that Team Dow rallied right from the start of this pandemic. To give you a little context about our frontline workers, we have about 14,000 of them out of our 36,000 employee population. So we are a global material science provider. At the top of our ambition is innovation, it's our customers, it's inclusion and sustainability. We actually manufacture raw materials that go into 99% of the products that are essential, that are needed during this pandemic. Things like disposable gloves, like gowns, masks, respirators, cleaning solutions, disinfectant. And so it became essential for us, and we were named an essential business right from the start, to keep operating safely. So every day, and this has been consistent since March, we've had those 14,000 employees come to work, adhere to our pretty stringent state safety procedures, and our operations are still going full steam ahead. Let me tell you, though, about some of the key actions that Dow has taken. First, we have shifted some of our manufacturing assets to actually make hand sanitizer. We don't make hand sanitizer. We make the raw materials, but we actually don't, that's not one of the products that we produce. So we stopped producing other products to make hand sanitizer and get more out to the public and into our healthcare system. We also designed new face shields, and we did that in concert, right, with other companies. And then we shared that open source design publicly. Because again, we couldn't make them fast enough. We needed more people to start making them because they were so important to our frontline workers in the healthcare industry. We also designed with Whirlpool and Reynolds personal respirators. And we actually accelerated from design through development to production in about 7 weeks. So working across sectors with multiple businesses and companies to make that happen. We also partnered with other companies to make medical isolation gowns. And then we donated things like hydrogen peroxide, as well as packaging meals, tens of thousands of meals to others around the Dow world because they were in need, right, to our vulnerable populations. Our foundation also gave $3.7 million, and that was distributed across the Dow world. So in all of our major countries.
That's great. That's amazing work. Thank you. Melissa, why don't you tell us about Abbott?
Sure. As hopefully most of you know, we're a healthcare company. And so the front lines for us during this time have really been those frontline healthcare workers. And as the pandemic has evolved, certainly other essential industries as well. From the very first, we really focused on frontline healthcare workers. In fact, our initial ID Now rapid test distribution strategy was aimed to support frontline workers so we could keep them on the job and get those who were affected out and quarantined. In addition, we've donated $23 million across the globe to really help frontline workers around the world. And a few of the things that work has done include our work with Direct Relief to support 25 federally funded health centers here in the hardest hit U.S. states, which, that funding is helping community centers that serve predominantly Black and Latino populations by strengthening screening, testing, and triage. In partnership with CARE, we're helping train and support frontline workers in countries like Afghanistan, Colombia, India, Uganda. In Canada, Colombia, Poland, and the UK, as well as the US, we've donated our continuous glucose monitoring system, Freestyle Libre, for use in hospitals so that they could remotely monitor patients and save on PPE and save healthcare worker exposure during that time. And in Africa, we're partnering with the African Federation for Emergency Medicine to provide virtual trainings on COVID-19 care to more than 2,000 healthcare and frontline workers. So those are a few things that we're doing. Again, we focus primarily on healthcare frontline workers, but have evolved that as time's gone on.
Fantastic. And Hugh, tell us about DSM.
I'm happy to do so. So, when the pandemic first struck, our initial reaction, like I think everybody, was what do we have to do to keep all of our employees safe? And so, like most companies, we sent what we would consider to be non-essential, although they hate to hear that, workers to work from home. And those that were working in our operating plants, making nutritional ingredients and food ingredients, they were the essential frontline workers that we needed to double down on protecting. And I think the company did a good job at the outset, sort of pre-staging PPE before the pandemic hit the US. And so we learned a lot from our experiences in China and Europe that it was going to be pretty hard to find N95 and surgical masks. And gratefully, we had them all here when the pandemic first came to the United States, and we were able to distribute them to our 38 sites around the US. It was important to keep those sites up and operating because if they shut down, in about 2 weeks, there'd be no food on store shelves. So we provide the ingredients that go into beverages or animal protein or packaged goods or soups. And so we were very, very essential in keeping sort of that logistical supply chain all the way to the store shelf in line. That was not always easy for governors and other state regulators to understand. And so we also had to spend a lot of time helping our government officials understand how supply chains work, understanding how logistics work, and getting that up and running. We worked very hard to keep those essential employees healthy and safe. We started a campaign called Optimize Your Immunity. Being a big nutrition company, we understand the power of nutrition. And so we began to ship our own nutritional products to our different manufacturing sites to be distributed to the employees and their families. I mean, some of them are here. They're called Mix Me sachets. You just pour them in water, drink them down. You get all the essential nutrients you need to stay healthy and improve your immunity. But what we learned soon after was we had maybe a little more than we needed. And I went and I donated some masks to like the local police department where our headquarters office is, put it up on Twitter. The next day we were overwhelmed with requests from frontline workers, from nurses, from hospitals, from law enforcement, from veterans homes who couldn't get their hands on the PPE they needed to keep their own employees safe. And so we started a campaign right away, going to visit these facilities and sharing all of the surplus, and we're talking tens of thousands of N95 masks, with those who needed them. We began to also make face shields for other organizations, and those that aren't in the nutrition or food business in our company pivoted their manufacturing processes away from, saying, making resins to making hand sanitizer, or away from making engineering plastics for electronics to making engineering plastics for ventilators. And so it's been an interesting experience. At the end of the day, though, I think that it all worked for us because we trusted the guys and ladies on the shop floor, that we trusted them to keep each other healthy, to keep their colleagues healthy, to come to us with ideas on how to do that better. And it was a tremendous learning experience, I think, for the senior leadership of the company as to how much you can accomplish when you trust.
Absolutely. And all three of you have talked a little bit about the importance of covering, first and foremost, the safety of your employees and those basic needs of your employees and the communities around you. But what about innovation during this time? We've also seen just tremendous, just jumps in innovation. What have you found is working? What is not working? And Melissa, we'll start with you this time.
Well, at Abbott, we like to say that we were built for moments like this pandemic, although we hope we don't see another one like it. We've long been an infectious disease leader. We invented the first HIV test. And so we have a lot of in-house scientific know-how. So when COVID hit, we assembled 4 R&D teams to come at the virus from a number of different angles, because we knew that different types of testing would be needed in this kind of a pandemic. And really, our scientists took what would normally take years and brought it down to a month or a little more than a month for the various tests that we actually developed. And that just took 24/7 know-how. I would add that innovation, though, in a time like this that doesn't have scale, really is kind of useless, right? So one of the things that we did was invested hundreds of millions into a couple of new manufacturing facilities to be able to make our rapid tests at scale. And so, so far, I think we've provided through the end of over 200 million tests around the globe, 80 million here in the US. And I think that one of the things to really note here is, innovation is critical. We need the innovation, but you also need the scale in a pandemic. And so without going into too many details, there were lots of challenges along the way, and what you would normally have is a few years compressed down to a month for the scientific side, and then just a few months for the manufacturing side. It's a Herculean effort.
It sure is. Hugh, what about you?
Yeah, I could say that we tried a few things with respect to bringing together consortiums of companies and organizations to develop new innovation and ideas, and that didn't necessarily work all that well. And I think part of the challenge there was you can't operate with that speed. And being at a distance, as we all are today, it becomes much more difficult to collaborate. There's many areas where I think we were successful, and I'll just focus on one in the interest of time. You may see studies out there that talk about vitamin D, and that folks who have low vitamin D levels are much more susceptible to COVID-19, and if they get it, they have much worse outcomes. I think that there's a recent Spanish study that showed that 83% of the people with COVID-19 were vitamin D deficient. The challenge is it's very difficult to get enough vitamin D through your food. You can find some in egg yolks and fatty fish. And this time of year for all of us, except for me, a little red, it's very difficult to get the vitamin D you need from being outside. The sun is at the wrong angle. It's getting cold out. And so being a big nutrition company, we said, we can figure this out. And we developed a form of vitamin D. We'll call it Ampli-D. It doesn't really have a fancy name yet. That is 25-hydroxy vitamin D3. It's the type of vitamin D that's circulating in your bloodstream today. When you get a vitamin D test, that's what they're testing for. This can raise your vitamin D levels in a matter of a couple of weeks versus 6 months if you supplement with ordinary vitamin D3. This is one of those sort of, I think, step change innovations at speed and potential scale that we need to tackle this pandemic. If we can get a product like this out to the tens of millions of people that probably need it, both the elderly especially and people of color who don't absorb as much sunlight, I think we can make a material difference. And we're working hard on that. And that's I think, an innovation that would take us years to do in ordinary times, but with the catalyst of urgency, we've gotten it up and off the ground very quickly.
That's fascinating. Really, really interesting. Nancy, what about you? Nancy, you're on mute.
Of course I was. Sorry, that was bound to happen. Dow has a stellar research and development organization, and it is around the Dow world. And, with R&D, our researchers, and right in your companies too, they step into the lab and they're ready to try new things, right? You try new things and that didn't work, and then you try something else and maybe that sticks, or you tweak a little here. So we are used to solving real world challenges in our labs. And that's really what we did. Our plastics organization stepped up. They quickly mobilized a global team, and that's the team that created these new medical isolation gowns, these face shields with other companies, these new, the personal respirator system. That was something that, I haven't seen from other companies as well. So our innovation really continued and shined through during this pandemic. The other thing we did is we were getting requests from all over the world. I mean, hundreds of requests on a weekly basis. And so we created an intake process. How do we manage these requests, and how do we distribute? How do we make those decisions? It shouldn't be up to us, right, on who gets the sanitizer and who gets the gloves and who gets the masks. So we worked with healthcare organizations and universities and our key internal technical experts on how best to address that and how to deliver. It got down to the point where one member of our team actually put some hand sanitizer in the back of his pickup truck and drove it down to U of M to their hospital. So it was all hands on deck, but innovation certainly shone through, even down to the truck example.
Absolutely. So I'm going to ask one more question, and then we're going to see if we have any questions from the audience. But my next question is around diversity. And frontline workers are a racially diverse group. And we know that COVID-19 has hit Black and Latino or Hispanic workers particularly hard. So how is your company addressing this topic or advising workers on this? And Nancy, we'll go back to you for that one.
All right, thank you. We're doing a couple different things. First, I mentioned at the very beginning that inclusion is at the top of our ambition. We have something we call Dow ACTS, and ACTS stands for Advocacy, Community, and Talent. We have a global strategy on how to address racial injustice, and we have allocated millions of dollars to achieve that. COVID related, we looked across our communities and looked across the world, our most vulnerable populations, our underrepresented minorities, to determine what are the greatest needs in these communities. And working with our global network within Dow, we quickly realized virtual learning is not the same for everyone. There are communities and populations that do not have access to internet. They do not have the equipment that they need, even if they did have access to the internet. They don't have a Chromebook or a laptop, or they would need to either go over to a friend's or go sit in the school parking lot in order to connect. So we provided grants across our Dow regions to schools and nonprofits where we knew they could allocate those funds to help buy the equipment, the hotspots, the internet connections that would help those students and those families connect to allow learning to continue. And then just one other small example, but we did this around the world, is providing, packaged meals and, just necessities, cleaning supplies to those that really needed it the most. So yeah, we looked at those populations and definitely wanted to make an impact.
Great. Hugh?
Yeah, 2020 is an interesting year. I think it's largely defined by the pandemic, but not the pandemic alone. We had a very heated presidential election, and across the country, we had a lot of issues with respect to race and social unrest. And, all of that just got amplified. All of the stress, all of the anxiety, all of the isolation that employees felt is amplified because many of them are at home. They're afraid of the virus. They're being inundated by media and social media posts around some of the racial and social issues. And that, to me, all came to a head Memorial Day weekend. It was after the murder of George Floyd in Minneapolis, where everybody was watching on TV what was happening. And knowing our employees like I do, I knew that this was something that I had to say something about. And so I sent them all a letter Monday morning. And it was a very probably ham-handed, but very authentic letter about how I felt, what I thought, and trying to express some empathy on what the experience must be like for others, to create an environment where maybe there was some safety in having a conversation around these issues amongst colleagues in the workplace. I think historically, we all work for big multinational companies. We know a lot of these issues, these difficult issues, are left at the threshold of the corporate door anytime anybody comes to work. But that doesn't allow everybody in the company to bring their whole selves to work every day. And I think we needed that now more than ever. And so as a consequence of that letter, I actually got hundreds and hundreds of emails back from our employees who were grateful in some respects for being seen and heard for the first time, from others who did not like at all the idea that I was raising issues like this in the workplace. But I think it served its purpose. It served as the basis to foster a conversation about things more than just the P&L or what goes on in the corporate social responsibility group, about what's really affecting all of our lives every day. And I think the takeaway when we move into 2021 will be, we're going to have to give people permission and a safe space to have these conversations in the workplace, or we're going to continue to have divisiveness and a lack of inclusion, and diversity in the company will suffer as a consequence. So I go into the next year very hopeful, coming out of a year that was very challenging.
Couldn't agree more. Melissa?
We internally, we've been having lots of conversations. At Abbott Diversity, we have a very diverse business model. We've valued diversity, but we know we're not perfect. And so we've had an ongoing conversation from the start about how we can be better. The other thing, our purpose of helping people is one that really motivates our employees. And so, we heard a lot from our employees about, can we do more in the communities? We know we help underserved communities, but can we do even more? And so, one of the things my team and I are doing is really giving small grants so we can learn and so we can continue to have even bigger impact. One thing that we've seen more recently, actually, is the University of California, San Francisco. They conducted a study in the Latino community with our Binax Now rapid test and found that it was a very useful tool in reducing the spread of the virus, because a lot of these families, they live in multiple families live in one dwelling, and they need to go to work because they're essential workers. And so, we're both looking at what we can do better internally, and at the same time, looking to have even bigger impact with our products and our sustainability work in our communities.
Thank you. We have time for one question coming up on the end. Are there any questions in the chat? Don't see any. So I will, I guess, just ask that if each of you could maybe leave us with, oh, wait, here comes a question. Let me go ahead and ask this one. Given the current political climate, can you provide insight on any challenges as a result? Any of you want to take that?
I'll take it very briefly. It's it is a tremendous challenge in any organization, especially organizations that are diverse in terms of geography, diverse in terms of education of employees, diverse in terms of nationality. And I think it goes without saying that we're living in one of the most divisive times politically ever. And and this is my expression of personal opinion, the media, the social media, like to keep us angry, like to keep us anxious. If they keep us angry and anxious, we keep tuning in and they keep selling advertising. And so for me, the biggest challenge is having conversations with employees to help them understand that they need to think for themselves, that it's okay to have a difference of opinion from a colleague without holding that colleague, as lesser than. And to do that by setting examples at the senior leadership level of the company. I could tell you, I do write to all of our employees every Friday morning, and we talk a little bit more than just coronavirus. A lot of it has to do with politics. A lot of it has to do with social issues. Not all of it is universally well received. But until we enable these types of conversations, between adults in a stable manner, this political divisiveness is only going to continue not only in our country, but creep into our organizations. And I don't think that we can afford that as a country or an organization.
Hey, Jenny, this is Nancy. I'd like to kind of pile on to that. Early on in COVID was a separator. And later on, it became a convener of business, of industry, of thought, innovation, charity. And that's what we have to keep at the forefront. 2020 threw a lot at us. We're not done yet, right? We had lots of hurricanes, and our corporate headquarters is in Midland, Michigan, and we had a major flood happen. So, the issues kept surfacing, and we rose to the occasion, right? What doesn't kill you makes you stronger. But we need to keep that collaborative and innovative spirit. We need to keep breaking down the walls across sectors and across industry to continue to innovate and to make a difference. I got to say, I'm so proud to work for a company like Dow because, right, they made things happen very quickly. They broke down walls and they created new partners, and they helped people in need when they needed it the most. And we made things we've never made before. And, for a revenue generating company to put some things aside and to keep operating safely and to keep people working, it was sobering, and it still is. Proud to work there. So thank you.
Absolutely. And I think that's just a common theme across all of these corporations today is everyone is just looking for ways to support our employees, to support our communities, and to help end this health crisis as soon as we can. Right. So thank you all for joining me. It's been a very inspiring conversation, and I look forward to hearing more from each of your companies. Thanks, everyone.
Thank you.